Hi, my name's Rayleigh O'Loughlin and I'm the lead of the Integration and Redesign team at Eastern Melbourne PHN. My facilitator, Sarah Crowe, and myself manage the health coaching program and I'm excited to share with you the structure, implementation and outcomes of this exciting program. Eastern Melbourne PHN acknowledges the Wurundjeri people and other people of the Kulin Nation on whose unceded land our work in the community takes place. EMPHN respectfully acknowledges their ancestors and elders past, present and emerging. We recognise and value the knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them. We celebrate their strengths and resilience in facing the challenges associated with their recovery and acknowledge the important contribution that they make to the development and delivery of health and community services. Eastern Melbourne PHN, or EMPHN, works across all or part of the 12 local government areas seen here. Here is a snapshot of EMPHN's health demographics. The most relevant statistics for the health coaching program are that 80% of adults within the catchment have at least one chronic condition and 65% of adults are overweight or obese. Today we are here to talk to you about our health coaching program, a program aimed at building capacity to improve person-centred care in general practice. The health coaching program is an EMPHN-funded program and is part of our strategy to enhance primary care. General practices supported their nurse to undertake coaching training aimed at enhancing their role in chronic disease management and understanding effective behaviour change methodologies. This is the second iteration of this program. In the first tranche in 2017, clinics selected their own patient cohort. Following the evaluation and nurse feedback, it was identified that a more targeted approach would offer a greater opportunity to focus the education, workshops, and the data collection. For this reason, the eligibility criteria for participating patients was set as having a BMI of at least 30. There was a general focus on weight loss, as well as an improved quality of life and capacity for self-management. Kim Poiner from MediCoach was contracted to deliver health coaching, training and mentoring. Kim also supported nurses to practice and embed new skills that drive positive, maintainable behaviour changes in patients. It was also recognised that the model of care would be improved by including a patient education tool to enable the nurses to easily continue their coaching relationship with their patients in between visits. Healthily was contracted to provide access to their online GoShare platform. They also provided nurse training, support, and new diet and exercise content for the program. Sarah provided support through regular practice visits, video conferencing, phone support, and resources. Nurses were supported to continue working with their GP and practice manager to review and refine the model and look at how they could best align the coaching model with the needs of their patients and practice. Sarah will now tell you more about how we implemented the health coaching program.
Through an open expression of interest process, 12 clinics were contracted by letter of participation outlining clear deliverables and targets. Each clinic nominated a practice nurse to attend all training and implement their coaching model. The clinic also nominated a GP and their practice manager to support the nurse and ensure a whole of clinic approach. Practice nurses designed and implemented their coaching model to meet the needs of both their patients and their clinic. The program included an orientation workshop, a webinar on how to use GoShare, an education workshop on behaviour change, another workshop on care coordination, another workshop on integrated care, 6 online mentoring sessions with the 12 nurses and Kim Pointer to share challenges and successes and problem solve as a group, and monthly support from EMPHN through practice visits, phone calls, and teleconferencing. At the beginning of the program, we supported the clinics to create a swim lane map in order to organise the process for their coaching model and define roles and responsibilities within their own team. This encouraged engagement from all team members and allowed them to map out the patient flow of their model. Some of the clinic's models were aligned to facilitate and enhance use of MBS items, such as health assessments, heart health checks, and care plans. Others focused on vulnerable and socially isolated patients. Whilst all patients received one-on-one coaching, some clinics took the opportunity to develop group sessions, which created an opportunity to share ideas, experiences, successes, and challenges. Here are some of the participating nurses talking about their experience in the program. This is from Kath, a practice nurse at Access Health and Community in Hawthorn. We implemented the health coaching program in a group environment over a 10-week period rather than one-on-one consults, even though the 3 monthly reviews were one-on-one. We found all the participants enjoyed the social aspect of the group and integrated well during the allied health professional talks. Some participants were reluctant to ask questions or speak, but they were able to still listen to the conversations and advice given by the allied health professionals.
Hi, I'm Jean. I'm a nurse and I work in a general practice clinic. I have benefited greatly from the health coaching program with Eastern Melbourne PHN. Our program's name was Discovering Wellness. We focus on delivering quality patient-centered care for each patient we recruited. Throughout the whole program, I was given all-rounded support and training that equipped me with powerful tools of communication and empathetic approaches, ways to empower our clients to achieve their health goals and ultimately achieve a better quality of life. I had a client working towards a healthier BMI. I had the opportunity to guide and to encourage her, to support her in this exciting journey, leading her through different pathways. Seeing how happy she is at the end of the program gives me great satisfaction and fulfillment, knowing that lives have changed for the better.
Hi everyone, my name's Ali Mason. I'm the practice nurse at DPV Health. and I've been involved with the Eastern Melbourne PHN's health coaching program over the last 12 months. We've had some great outcomes, and for both myself, for our patients and our practice as well. So I'd like to share a really beautiful story with what happened within the project. So at the beginning, it was all concentrating on basically weight loss, but it was very quickly, I found that it was more about relationships and helping people to achieve small 1% positive outcomes, which then led to the next positive outcome. So I had this lady, a very busy mum with 4 children, and has a husband, was struggling with her weight and her dependency on Coca-Cola to begin with, which actually brought her in. We spent lots of time talking about the triggers and her goals, and her main goal was to lose weight, but to get healthy, so that she could be a role model for her girls. So throughout our journey, it was wonderful because they all got involved. They helped by putting up signage, you know, on around the house. They wrote letters of encouragement to her. And to top it all off, she brought her husband in for a visit at one time, and we discussed it as a team, and he also became involved in her journey. So it was a reflection on her to be able to introduce information in a way that the whole family could understand. And together as a family, they've made outstanding achievements by modifying their diet. And it was just amazing to watch. So what I've learned from this project over the last 12 months is the invaluable connections that can be made between the nurse and her patient, but also with the patient and the GP and all the allied health professionals that are engaged with that patient as well. Giving my patients the tools to be able to talk the language that is required to get those 1% changes, and to help to advocate and stick to the goals that patient is making. I can see that health coaching is the way to go and moving forward. And it's going to be an exciting journey in the next few years to see that evolve. And I'll be certainly being part of it, and hopefully to be part of it in the future.
This is from Tanya, a practice manager involved in the program. I was involved as a practice manager in relation to helping our nurse and GP with deciding exactly what we were going to do and what sort of patients we were going to aim at. I then left the nurse to her own devices, and she did very well with the whole process, keeping up contact with her patients and working through the program with the GP. I had a nurse in another clinic that I manage go through the first tranche of the program, so I knew the benefits it would bring, and I was glad that this nurse was very keen to participate. Some of our doctors were happy to support the program, but I was keen to really empower the nurses to show the benefits of being involved in chronic disease management. I feel that this program not only gives the nurse the skills, but also the confidence to be able to do more in the space of nurse-led clinics and chronic disease management alongside our GPs. This program was a way of showing GPs that there is an untapped resource there, and highlighting the skills the nursing staff have to improve integration and effective health management. COVID-19 hit Eastern Melbourne in early 2019, and the first lockdown began in mid-March. This had a significant impact on the way healthcare was delivered, but also on people's general health and well-being. We anticipated this would affect the clinic's ability to continue delivering the program. But clinics and nurses quickly adopted telehealth capabilities where needed and continued to support patients throughout both lockdown periods. "117 patients were recruited across 12 clinics. Some patients exited and re-entered the program, with 75 patients attending the final 12-month review. 55 patients completed every review, and we used these patients to collate and analyse the health outcomes. Patients were assessed at their initial appointment at 3 months, 6 months, 9 months, and 12 months, using a survey that checked basic health measures like blood pressure and weight, and used the Coop-Wonka charts to measure functional status and health-related quality of life. The average BMI of participating patients at the beginning of the program was 38.5, and the average BMI of the same patients who completed every review was 36.2 at the end of the program. There was a slight improvement in the patient's self-reported quality of life, change in health, and general feelings. But even more impressively, there was no significant drop despite the 2 COVID-19 lockdowns in Melbourne during the program. A level of maintenance was achieved by supporting the patients throughout the year. One of the measures, feelings, asks the patient to rate how much they've been bothered by emotional problems. Knowing that a lower score is more positive, the average at the beginning was just above 3, and the average at the end of the program was below 3, despite the 2 lockdowns that occurred in Melbourne during this time. Participating clinics were surveyed both at the beginning and the end of the program to measure their confidence in different areas, such as using a multidisciplinary team and whether clinicians involve patients in their own goal setting. As you can see here, there was an improvement in their clinicians involving the patients in setting their own goals. Practice nurses were always surveyed after every education workshop and mentoring session to evaluate the sessions. Here are some of the key takeaway messages the nurses reported as significant to them. The importance of good leadership in stressful times. The idea to not solve every issue at one time. Target a maximum of 3 goals and be realistic. We're happy with 1% changes. Focus on the positive and approach the negatives with empathy. And continue the regular follow-up with patients, encouraging and motivating them to succeed in achieving their goals.
In light of the extra pressure on general practice this year due to COVID-19, and in response to requests from participating nurses to continue their coaching model and training, we have decided to offer an extension to existing practices to continue the program for a further 18 months. The extension will include further training for nurses, ongoing support for existing patients, recruitment of additional patients, creation of a health coaching nurse network with an online forum, and mentoring sessions offering an opportunity to practice and embed newly learnt concepts and skills. Thank you for watching our presentation on health coaching, and here is how to get in contact with us.